as Mr. Luetkemeyer.
Thank you, Mr. Chairman, and Ranking Member Scalise. Thank you also to all the members of the panel today. The Select Committee is brought in. We appreciate your comments today on the effects of the early shortages and continuing shortages and risks that you incur with regards to PPE. I know in my state, our governor has said we have adequate amounts of PPE. Not that we have a lot to spare, but we are okay. And we're glad for that, and in fact are making a lot in our own state. Since the coronavirus outbreak began, medical professionals, first responders, and other essential workers have worked tirelessly on the front lines. Truck drivers are making their way across the country to ensure grocery stores continue to receive supplies, and grocery store workers are ensuring the shelves are stocked so families have food on the table. Custodians, factory workers, farmers, the list goes on for the countless individuals risking their health as we continue to fight this invisible enemy. And many of you are on the panel today, and thank you so much for your service. But as states are in the early stages of reopening, those workers also will play a significant role in getting our economy back on our feet. And again, thank you for being here today. It was interesting. We're trying to get everything reopened now, and I know that Dr. Rainey made a statement a minute ago about data and science, and I just kind of put together some information here just in the last couple days with regards to reopening. It seems across the board, even all different media outlets, and some of them that are not necessarily on the conservative side, have started to run stories about it's time to reopen. It's time to reopen. And again, just within the last couple days, I saw a doctor on there who talked about the deaths of despair. People are dying, and he said we'll run around 75,000 people are dying or will die with other things other than COVID, and the result of COVID being focused on at the expense of them with regards to suicides, heart attacks, overdoses of drugs, homicides. He said that there's 90% are not getting cancer screenings any longer. And I know last week or week before we had another meeting, Congressman Green made a comment there's probably going to be over 30,000 people die because of the lack of screening and the lack of treatment that they're not getting. 600 doctors have just recently signed on to a petition that says they need to go back to work. Over 30 people died in one particular area where they didn't get heart surgeries. Suicide rate the highest since the Great Depression. These are statements that they're making on TV. Not I'm making them. I'm pulling them right off the TV screen. Drug abuse, alcoholism, child abuse, domestic abuse, all up. And it's kind of interesting because we're letting felons out at the same time we're putting seniors in nursing homes where they're more likely in a high-risk category to be infected. Last week we were in D.C. trying to pass a bill that would make it more easy to vote. And the reason is, we're voting by mail, and the reason is that you're going to not have to stand in line anymore to vote. Yet everybody stands in line to go to the grocery store, Walmart, the liquor store, even to get tested for coronavirus. It's amazing to see this, and I know, Mr. Pettis, you've experienced this from New Orleans being a hotspot, and now starting to reopen and see how people are responding and how the businesses are responding. Can you give me kind of an overview of how you think the reopening is going and what else needs to be done to get this done?
Well, it's going slowly. I will tell you the anxiety level is being experienced by everyone. And I used the analogy earlier that we're 4 fathoms down and gasping for air because a few times a week, that's how I feel. I wake up in the middle of the night, and it's surprising that the number of team members have felt the same. It's kind of a joke with us because they all feel the same way. They're just so anxious as they get past. Our community seems to be doing very, very well. Our mayor's been touting our success. Government's touted our success, and so we're moving in the right direction. But it's time to keep moving forward with regard to the economy because that is the next wave. That is the curve that we're worried about because their anxiety level, and we think that the amount of money that we have for PPP is going to help us, and it is. We're very, very grateful for everything. But that's going to run out, and like I said, we're going to be laying people off by the hundreds. And 85,000 people in New Orleans in the hospitality industry, a community that's reliant on tourism. They're not it's not going to be successful. And so it is just anxiety.
I know that you've done a great job in detailing there a minute ago all the things you're doing to protect the workers and customers of your restaurants. That was a very impressive list of things you were doing. And I know that one of the solutions that we're trying to get the economy up and going is perhaps discussing a payroll tax cut. How important would that be to your employees to get a 7.5% raise? I know a while ago one of the other members of the committee made a comment about how important it would be to get a pay raise. So that would be something I think would be very beneficial. Would that be helpful to your employees and to you?
It would be absolutely to us, yes, but we try to look through the eyes of our coworkers as well. Ours is an industry that people don't grow up thinking, I'm going to work in the restaurant industry. It's an easy entry industry, and we take people where they live and teach them a profession and how to be a cook or a waiter, and hopefully make a good living. Any raise would be greatly appreciated by them, I'm certain.
One of the key.
Thank you very much, Mr. Pettis. Mr. Pettis, thank you. Mr.